Welcome back to the channel. In this video, we will learn about MRSA and Pseudomonas, two of the most common resistant microorganisms that we see in clinical practice. I will discuss some similarities and differences between them, including how they are identified, the types of infections they cause, the resistant mechanisms, and treatments. If you end up learning anything from this video, or you like the way I present the information, then please hit the like button and subscribe for more videos like this. Thank you. The name MRSA refers to the Staphylococcus aureus bacteria that is resistant to a drug called methicillin. We can simply refer to this as Staph aureus. Now, methicillin is a beta-lactam, just like penicillin and others. Although the name implies that the Staph aureus is resistant specifically to methicillin, it's actually resistant to all beta-lactams. We will discuss more about this later. Staphylococcus is a gram-positive bacteria, and aureus is one of the species, so Staph aureus. They have this spherical shape and are usually in clusters, just like how the staff at your job cluster together and chat. So that's how you remember it, staff, clusters. Anyways, regular Staph aureus and MRSA are actually part of our normal human flora. This refers to bacteria that normally reside in or on humans and does not cause infection. MRSA can normally be found in our nostrils and on our skin. Next, we have Pseudomonas, which is a gram-negative bacteria. They have a rod shape and present with one or more flagellum to help them move in different environments. And just like Staphylococcus, Pseudomonas can be found in the oral cavity and intestines. So the question might be, if normal people carry these resistant bacteria, how come they don't cause infections in all of us? That's because both of these bacteria cause opportunistic infections, meaning it can be completely harmless in the healthy but cause infections in the immunocompromised. So being immunocompromised is a risk factor for becoming infected with both of these bacteria. So patients with HIV or cancer are a prime example of immunocompromised patients. Other risk factors for MRSA and Pseudomonas include prolonged hospitalization or recent hospitalization, especially in the ICU, simply because most of these patients are immunocompromised. And these type of infections are also known as nosocomial infections because they happen in the hospital setting. Next, recent antibiotic use. And this is because it could potentially disrupt the balance of the normal human flora, making bacteria that wouldn't normally cause any problems become more virulent. Other risk factors include having open wounds, since MRSA lives on our skin, having structural lung diseases such as cystic fibrosis, and long-term indwelling catheters. Another thing I wanted to mention for Pseudomonas is that it's commonly found in the environment, especially in fresh water, so jacuzzis and pools. In the hospital setting, it can also be found on sinks, ice makers, and medical instruments like endoscopes. So knowing these risk factors, if a patient unfortunately develops an infection with these bacteria, for MRSA specifically, it will most likely be infections such as pneumonia, UTI, osteomyelitis, and endocarditis. And for Pseudomonas, it could be pneumonia, UTI, bacteremia, and endocarditis. Of course, in ID, we treat based on the microorganism. Regardless of where the infection is, what's important is to identify that it's either MRSA or Pseudomonas so that treatment can begin. And there are specific features that helps us identify MRSA from other gram-positives and Pseudomonas from other gram-negatives. Staphylococcus are gram-positives, so they stain purple. I don't want to go into detail about this, but just know some things are added to the bacteria, and if it stains purple, it means it's a gram-positive bacteria. Next, Staphylococcus species are catalase positive. This helps us distinguish them from other gram-positive cocci like Streptococcus or Enterococcus. Catalase is an enzyme that converts hydrogen peroxide to water and oxygen gas. The test is easy to perform. Bacteria are simply mixed with peroxide. If bubbles appear, it's due to the production of oxygen gas, so that means the bacteria is catalase positive. MRSA is coagulase positive, so unlike the catalase enzyme, which is present in all Staphylococcus species, coagulase is mainly for Staph aureus and other less common species. MRSA also has this gene called the MECA gene, which we will discuss the significance of this later. When Pseudomonas is stained, it comes out pink because it's gram-negative. It is also catalase positive and oxidase positive. When peroxide is added to the microorganism, the color will change to dark purple in about 5 to 10 seconds. Pseudomonas also has a unique ability to grow at up to 107 degrees Fahrenheit. And finally, Pseudomonas produces colonies with a characteristic grape-like odor. Before we dive into the antibiotics that will cover these bacteria, I think it's important we understand the mechanism of resistance of these microorganisms and why some medications won't work against them and only specific medications will work. So the mechanism behind how Staph aureus becomes resistant to methicillin all starts with the structure of beta-lactam antibiotics. These include penicillins, cephalosporins, and carbapenems. One thing they all have in common is this beta-lactam ring in their chemical structure. Normally, in bacterial cell wall, there is an enzyme called transpeptidase. Transpeptidase is important for peptidoglycan synthesis, important component of the bacterial cell wall that provides mechanical stability. When a beta-lactam like penicillin is administered, it binds to the transpeptidase, also known as penicillin binding protein, inhibiting the cell wall synthesis, which will lead to cell death. This is the mechanism of how beta-lactams normally work against methicillin-sensitive Staph aureus. When Staph aureus becomes resistant to methicillin or majority of beta-lactams, it's due to a gene called the MECA gene. This gene encodes for a type of transpeptidase called penicillin binding protein 2A. Just like other transpeptidases, it synthesizes the peptidoglycan to help stabilize the bacterial cell wall. When a beta-lactam like penicillin is administered, it's unable to bind to this penicillin binding protein 2A fully and inhibit it because of reduced binding affinity due to the MECA gene. MRSA also have these enzymes called beta-lactamases. These enzymes are able to break down the beta-lactam rings and make it inactive. These are all reasons why traditional beta-lactams are inactive against MRSA. Now, Pseudomonas also have a few tricks to prevent antibiotics from working against it. One is restriction in the outer membrane permeability. This will prevent drugs from crossing into the bacteria. Next are efflux systems that move the antibiotic that has entered the bacteria outside of the cell. Lastly, they produce beta-lactamases that can inactivate antibiotics. Because both MRSA and Pseudomonas have these resistant mechanisms, we have to use specific medications that still are effective against these microorganisms. So here are some examples. These are not in any specific order. All these drugs have chemical properties and mechanisms that prevent them from being impacted by the resistant mechanisms of these microorganisms. And that is why we're able to use these drugs. And that will be the end of this video. Hope you learned a thing or two and it didn't take too much time. If you did, then make sure to like, subscribe, leave a comment or question down below, and follow me on my Instagram at Pharmacist Academy. Thank you for watching this video and take care.